I recently learned there's something as an endo warrior smell where you can be here, and you can smell, like you have super smell. I've had it for years. I can sit there and I'm like, something is burning.
My nose is useless. I could sit here and something is burning in the kitchen and I might never know.
But there's also another part of endometriosis that isn't talked about a lot, and that is that constant shoulder pain.
More than not is the right shoulder.
Yeah, that shoulder blade thing.
Oh, listen. Pregnancy does not cure endometriosis. Please stop telling endo warriors to get pregnant. Hi and welcome back to Thrive with Mulunji. I think together with the two ladies we can categorically say Happy New Year.
Happy New Year.
It's been a long time coming, but thank you so much for your support. Thank you for being part of this family. And this being March, you definitely know that we and our teas are back here to chat about something that we live with, and that is endometriosis. Every March is Endometriosis Awareness Month. That does not mean that we get breaks. No, unfortunately. We could even testify and say most of us are seated here with the help of painkillers. But I'm not by myself, as you could tell. My name is Mulunji, and together with
Sheila
and
Jamaki.
We're here to talk about living with endometriosis. Oops. My tea has what part?
But that means we have endo things to spill.
Indeed. Spilling the tea. Literally spill.
Anyway, we are spilling the tea about endometriosis. It's been a while. So we're going to start by a little catch up. Where have we been? What have we been up to? And I think let's start with Sheila, because the last time we were here, Sheila needed to go for a surgery. But alas, we are grateful that that went well and she's here. So without any further ado, where have you been?
Happy New Year indeed. As Mulunji said, yes, when I was here last, we talked about fundraising. What was happening to me at the time was my kidneys were failing. And when we say endo is a whole body disease, we really mean it. Anyway, I think it's, for me, it's of all the surgeries I've had, it was the most scary because of how serious I know the kidneys, like how much we need them. It's like you always know you need surgery. Anyway, yeah, I had surgery. The kind of the surgery I actually had was, I had a total hysterectomy. But, so I had my uterus removed. And this did not solve the problem of endo, but it was so that I wouldn't get more growths on my ovaries and all of that. But I also had adenomyosis, just to be clear, that it was not so much for endo as it was to remove the cyst that was sitting on my ureter. Yeah, so far it looks good. We'll find out how we are doing. But yeah, that's about it. I also found out I still have it on my diaphragm, on my liver. So we'll see as the year goes.
Indeed, but we're so glad to have you back, and we're glad that that went well. It sounds very serious. Where have I been? The last time I was here, I had a knee brace, so I also had to undergo an ACL reconstruction surgery, as well as a meniscus tear repair. And yeah, that was around October. That was from October. I have been very much unemployed, very much at home, recovering, going for physiotherapy. I have new endo symptoms, who would have thought? And yes, my ACL issue also partially was because of endometriosis. And I am a bit better today, thanks to painkillers. I think since it's Endo Awareness Month, the flares decided to come with some very weird force, but I'm glad to be here, glad to be with the girls. We'll share with you a bit what's in our teas after Jean tells us what she's been up to.
First of all, I just like to appreciate, I think the first time we did this, I said, it was a terrifying space to be. It was very vulnerable and very personal. I was not very keen, so I felt bullied to do it, and now I'm glad that we do. Yeah, but I think for Sheila, it's really so selfless of you to be very vulnerable. And I think same for you, Faith, and I really commend that. And I think that's been the resounding thing, like the vulnerability of this disease. There's no pride in being an endo warrior, and but we hope that this means something to you. Yeah, so the past couple of months have been quite the pits. I'm going back and forth in denial of my next surgery that I keep pushing every month. The last visit I had in November, which led to mostly my doctor telling me, I've done everything I can in this particular country, there's no further technology for you. And I walked away not knowing what level of anger I felt. And it's been that anger and processing that, has led me more to enjoy my couch and also look out for myself a little bit more selfishly. So I think I've just been in that space, just going between the outbursts of anger and the reality check that this is just not going away tomorrow. But also looking out for myself more, whatever that means. Quite the roller coaster of emotions.
Yeah, but I'm so glad you're here. So yeah, what's in our teas? I will start. I have chamomile and raspberry. These are not magic ones, but they sometimes help. Chamomile, there's actually a new study that shows that chamomile, it's just that they've not given us the quantities, that it's really good for especially sleep, for endo warriors. So today, I'm not going to sleep on set, but because I'm having an active, ongoing flare, I'm hoping that the raspberry and the chamomile will sort of help calm whatever flare that I have. What's in your cup?
I'll start with the positive thing. Like I put chia seeds, double my poison, just to feel better that I was taking a tea I shouldn't be taking. But there's also chamomile, so that's good. There's another tea that I won't mention, but it has cranberry. It smells really nice. So it's small things that make you feel a bit better.
Sheila, what's in your cup?
I'm taking very healthy tea, unlike Ja.
Judge you much?
Yes, I'm judging you. I'm taking immune tea. It's one of those flavors by the McCoy tea people, Sri Lanka. Yeah. Anyhow, but bias tea, that's a good gift. I discovered this not too long ago.
Yeah.
I like them, but I wish teas were also cheaper.
At least now you know what's in our cup. So today we practically want to talk about endo facts about endometriosis. The last time we were here, we talked about myths and we really poured our hearts out. Some of you have watched the videos and you've learned a thing or two. The rest are catching up, but we are grateful. So we are just going to be sharing what we've learned about this disease, and so that you can get to know. We will be checking our phones because we want to also make sure that we give you facts. We don't want to give you vibes. So in case you see us picking a bit at our phones, that's practically what we are going to do. So I think let's start off with a conversation that you had already set the ball rolling about endometriosis being an all-body disease in your experience.
So endometriosis is a condition where tissue similar to the lining of the uterus, which is called the endometrium, similar, not same, presents itself outside the uterus. Now the uterus is in the pelvis. The pelvis has many organs. This part, hip, from the navel, like to below the knee, that's our pelvis, right? So we have uteruses, uteri, we have ovaries, we have fallopian tubes, the reproductive system, then we have kidneys, we have livers. The upper bit towards the thoracic cavity is the diaphragm. So obviously, because of the pain, like the commonest symptom is pain. That's how we know there's something wrong with us when we are menstruating. It's always been limited to it being a reproductive disease, yeah? And it's honestly what I also thought to an extent. But here we are. My last surgery was about my kidneys. It wasn't about, and thankfully, it looks like I don't have endo in the kidneys, but this is a cyst sitting on my ureter, causing my kidneys to swell. And I had it in my bladder before. We've all had our rectums shaved or something done on them, the colon, So this is the digestive tract. So system is system. We know people who have had the late, what was her name? The Kenyan lady? Kakai. Anyway, the DJ, the Kenyan lady who passed away. For her, she had endo on her lungs. You know, if you Google, you find literature. Mulago, we've had someone with also thoracic endometriosis. Mulago, a case in Mulago. So it's a whole body disease. It's all body systems, right from the brain to the skin, the navel, anything, the eye. So it really is a whole body disease, and maybe if we begin to consider it more and more that way, you may help us a little better than you're doing right now.
But we've also actually lost people here in Uganda, ladies, to endometriosis complications. So I think that another fact about endometriosis that is glossed over is endometriosis can actually be fatal. Many times as warriors, you know, you're told it's not fatal, you're told it's a benign cancer. And there are all these excuses. I'm going to call them excuses because it's someone that does not live with your pain that gets to decide for you what's fatal or not. We also lost an endo warrior just last year, and she had had about 7 endometriosis surgeries that later on the scar tissue gave her cancer. And while she was in remission, they said the cause of death was a blood clot. But when you look at all the things that her body had gone through, when you look at the pain most of us experience, just this week for me, I've not been able to walk, I've not been able to do anything. It goes to show you that endometriosis is still understudied, but it can be fatal. I was reading about a case where, you know, in your case where, you know, there is a cyst. Now there is a lady who the endometriosis just went and just constricted, you know, no more nerves and no more blood vessels. So if a disease can do that to you, it definitely can harm you. And I really call upon the medical practitioners to please stop treating endo as that's just pain. This is pain that can actually kill you in all aspects. It may not kill you physically, but it kills your dreams, it kills your hopes, and also the depression that it gives you. I need for us to do a little bit of more research and treat it as seriously as it actually is.
But again, talking about the fact that it does affect different parts, very autoimmune as well.
Yes.
And because we seem to associate it only with the menstrual cycle, for example, I'm on suppressants, I don't really get a normal cycle. That doesn't take the endo away. My nerves and joints are really, really not doing great. I know that part of that is also the medication, but it's been interesting to learn. So growing up, I had terrible migraines, and for the longest time, I really just thought, you know, I have such really bad headaches, and did MRIs and all the tests, and they just could not find anything. I also was asthmatic growing up, but as I got older,
Linkages.
And it's just in hindsight, then it starts to make sense that, you know, I'm still processing my thoracic endo, and which has been, I think, one I put on the side because it just did not make sense based on everything I thought endo was supposed to be. I think was the first shocker. The other was just to then relate that to my migraines, and then just the fear of, like, okay, you have lesions in your head. There's no uterus there. How do you have lesions in your head? So I think it's just the whole body effect outside of the, you know, uterus, and not just like shrinking it to that. It's a mind-boggling thing that even I don't know how to process as well. And I think that leaves me to paying attention to your body.
Yes.
And not normalizing. Because I say it's only now that I'm now taking stock, like, wait a second though, my headaches came at a particular time, and while I was asthmatic, but I just feel like I'm breathing blood, and that to me is like, maybe that's just a really bad asthmatic attack. Not really. And then I've stopped taking those things as, you know, it's just asthma, or it's just a headache. No, it's a headache that I cannot, has specific things to it. And now I think what I'm trying to understand is the nerve aspect of it. I think about 6 months ago, I was partially paralyzed. And that was the strangest thing that I've ever felt. You know, we get paralysis, it takes 30 minutes and goes away, and this was over hours. And then I realized, wait a second, the endo infiltrates this deep that I feel like I'm getting what do you call it when half of your body is back on?
A stroke.
A stroke,
Yeah.
because that's what it felt like. Yeah, so again, don't be very dismissive. It's not a painful period at all. And yeah, we're really hoping that early diagnosis happens.
I mean, in biology, they teach us the body is a system. You teach us this
Yes.
stuff. But when we go to see doctors, general doctors at that before, because that's where most people start from. The entry
Yeah.
point is a general doctor. And then because someone has painful periods, it's limited to that. To that. So I think all of us need a good education, especially our medical people, because that's who we come to. So for me, like Jean was saying, and Faith, that indeed, it's all these systems, they're linked together. Even I am doing a lot of linkages. Anyone that knows me knows I do have bad allergies still. But that's all histamine levels, you know? So it's a lot of interconnected stuff. Like, oh, this is why I have very bad allergies. Yes. Oh, this is why this is also in my family. You know, we have allergies. Then we have, what did you say? Well, for me it was an asthma, but it's really bad allergies. Migraines as well.
Yes.
I used to get very bad migraines. So now we're connecting dots looking back. You know, going forward, I really hope that we can treat this thing as seriously as it deserves. It is a whole body disease. Yeah. Whole means exactly that, the whole system.
I recently learned there's something as an endo smell, where you can be here, and you can smell, like you have super smell. I've had it for years. I can sit there and I'm like, something is burning. A tire is burning. And you know, like you said, if they help us and connect the dots for this illness, then maybe research will be done. But there's also another part of endometriosis that isn't talked about a lot, and that is that constant shoulder pain.
Oh my God.
You've experienced it too?
Specifically the right, often, more than not, is the right shoulder.
Exactly. And people tell you, change your pillows. I remember I would even change my mattresses, I would change my pillows, but I learned recently that it's actually because of endometriosis. I'd also like to state, and this is something that has been read about, that while hormonal contraception may help, it's not the cure and end and be all for endometriosis. This is something, there are current studies about Lupron, there are current studies about Depo-Provera, which has been banned in certain countries, that suppression of estrogen is not going to directly relieve endo symptoms. And it's so painful because while I advocate for people to go and have tests, when you go, the first thing you're going to be put on is hormonal birth control, which goes to show you that there is still a little understanding around this full body autoimmune inflammatory illness. Because okay, yes, you've given me this injection that is causing all these 1001 symptoms, but then because we don't yet understand how women's bodies work, it's going to suppress one hormone, and then it's going to like give you a myriad of other issues. So especially for the medical practitioners, why some of us that have sort of advanced with the disease, we reach a place where you're like, I'm sorry, I'm not taking any more of that, because you don't get to see that much change. It acts as a band-aid. You know, you go through all this depression, your body holds or water retention gets super high, and before you know it, you get to learn that the disease actually was not even asleep. Which brings me to another fact: pregnancy does not cure endometriosis. Let that sink in, because for every time any one of us has been told to give birth with the excuse, I don't know whether they explained to you, but as Kajanja patient, I asked, I'm like, why do you tell me to get pregnant? And their train of thought is your body will stop focusing on you for a bit, and then for those 9-10 months it's focusing on the baby. I've actually learned that there are women who realize that their symptoms actually worsen as the body is focusing on the baby. So when you give birth to the baby, the symptoms were also still growing, because like we said, the body does not stop, because we don't know what causes this inflammation. So please stop telling endo warriors to get pregnant, because the body is not stupid. If one part is causing endometriosis, it will still continue to manufacture whatever it needs to grow.
What she said, a band-aid, pregnancy suppresses the estrogen. Like, it suppresses the estrogen. But again, like she said, hormones are just a band-aid. Let me give an example. For a hormone that worked for me, but also harmed me. For example, I was on Visan. Visan is, okay, maybe I shouldn't be mentioning that drug. But anyway, that's a brand that helps. It's like the best out there so far, in quotes, that helps to suppress endo. And the truth is, when I was on it, from the time I was diagnosed, this is 5 years ago, for me, my periods stopped. As long as I had the symptoms still, but there was so, like my life was better since I was not bleeding, right? The moment I would get it off, the pain would come back. But now, fast forward, just here at review, post this last recent surgery of July 2025, one of the tests I had to do was a bone density scan, right? Because I've been suppressing estrogen, which I need for my bones. At only 41 years young, I have osteoporosis, which is really porous bones, weak bones. And my theory is, because it's not a very hard link to make, it's because of the Visan. I've over suppressed all women. Indeed, as we approach menopause, our bone density is lower because we're making less estrogen. But you see, so it's she said, a band-aid indeed. It's not solving the problem. It helped, but it has also put me in trouble now. Now I have to think about, what do I do for my bones so that they're not so brittle to break easily? And that is the good hormone.
Because we said it's a whole body disease, right? So that means that I need not just a gynecologist. I was looking for a really good, what are the people that do bones?
Orthopedics.
Orthopedic. And because for the longest time I went this particular place, and I do try to bring my file case just to understand, I have this underlying issue, not to make a sub story, so that you listen to me and understand me better. And as always, you get a one size fits all, but my pain and specific areas that I'm telling you, just don't touch there. As an orthopedic that has crammed that, do you sit long on your laptop? And what type of job do you do? You've not listened to everything else that I've told you about my illness. And again, I think it's been one of the hardest things, needing people outside the gynecologist space.
Yes.
Because you do need those. I had a really terrible malaria scare, which led me to platelets transfusion, but there were other issues happening around that, and it took the longest time. I don't think that was actually ever resolved because they were trying to bring in someone else to come in and see my past medication, because I had pain and I had a flare while I was there, and they were not really keen to give my medication. If anything, I felt like a druggie asking for certain medication. Like, we're treating malaria, we have a good gynecologist here who's going to go, kind of restart your journey. Like, no offense, but there's limited experts in this disease, and kind of feels hard because as the patient, you're also advocating for yourself. But which leads me to, I'm learning that it's important to keep stock of your body. But also go out of your way to get information.
Yes.
I had a doctor who recommended a drug that I only knew by, kind of listening and following Mulunji's work, that it has been banned in countries. Now, if I didn't know, because it was like, you need to make a rash decision, things are bad, so I'm going to move you to this medication. I'm like, I saw that somewhere. And heck no. And that's just, by default, I just had happened to see it going around, and I realized, okay, the medical space is not so much looking out for me, and I really need to look out for myself. But having the intersect needs of different practitioners in the space, and it's okay not to be endo experts, but just listen if I do tell you my symptoms and what happens to me, so you don't, kind of box me in anyone who has come into your orthopedic clinic, because then you're not helping me. But it affects more than one organ, so I need to see a head specialist. And that shoulder blade thing.
Listen, I think the other thing about endometriosis that gets very many women dismissed is it being like, not every endo warrior has pain.
Can be asymptomatic.
Right? Not every, because there are different types. There's a superficial, there is deep infiltrated endo, then there's the endometriosis that just manifests on top of the ovaries or around, let's say, like you have rectal endo, you have all of this. So sometimes there are women who get to realize that they have endometriosis without even the pain. So while painful periods may be an indicator, they are not the all and be all, especially when it comes to symptoms of endo. I've heard of people who throw up during, menstruation, or
I was those people.
You were, but also the fact that endometriosis inflames knees. I learned that after I had my SCL repair. There is so much about this disease that is unknown, but sometimes I wish that our practitioners would use the little they have, not to create like statements and sentences, but to use it for curiosity purposes. We should not just wait for endo to affect fertility first, because again, there are women who have endometriosis that are very fertile, because again, there's a difference between adenomyosis, which is, when the cells that behave like the endometrial lining grow within the uterus, that's adenomyosis. But endometriosis is wild and free. Think of it as Dora the Explorer, but the evil twin.
Likes to be in places it's not supposed to be.
Exactly. So just because a woman is telling you, "I know me, I don't get painful periods," but if they have all these other, the brain fog, that weird heaviness that doesn't go away, that tiredness, fatigue, exactly, you should look into it and be able to give them a solution and not tell them to go back and that the pain is in their heads.
Some people are symptomatic, though typically most people it's that extreme pain that gives us, like, makes us know we have endo, but it's also very individualized.
Yes.
Like Faith and Jean just talked about that smell. My nose is useless. I could sit here and something is burning in the kitchen and I might never know.
Oh, wow.
Yeah, and it's because of the allergies as well, because the sinuses get inflamed. So it's very, very individualized. I was on Visan, I stopped bleeding. I know people in Visan who kept bleeding.
It almost took me out.
Thank you, it had to be discontinued. So even these drugs, like, it's real one size it's not one size fits all. Yeah. It's very individualized. So let's pay attention, but I want to encourage those of us that live with endo to be our own advocates, because even the best doctor is not going to know where it hurts, how it hurts. So let's monitor our own symptoms, write them down, so that we can, because they work with the information we give them also. They can only try to help and work with the information they have. Could we all be better educated? Absolutely. But only I know my body more than my own mother, more than my friend, So it's very individualized as well.
If the three of us walk into your office, don't say, "But this has worked for Sheila." Yes, I've tried almost all of the injectables and all, and nothing seemed to work. But there are other ladies who will tell you, me that worked. So that does not mean there's something inherently wrong with me. That calls for more research and more looking into other safer options that will help. Do you have another fact?
I went blank. Yeah.
You went?
Yeah. Talk about the brain fog, but which we talk about, like, the intangible things of endometriosis, things like the depressive episodes, which I think we kind of talk about all these things that we can explain. We can explain why my curtains are going to be closed for the whole week. But life is happening. How about hype yourself up? And it's just a heaviness. Talking about that constant fatigue. It's like, but I've done everything, and it's just not going away. So much. Like, you just came back from a holiday and you feel very tired and unmotivated by life. I think it's those little things. But what I'm also learning is paying attention to the medication that we take and how that affects you as a person. And I think, like that Sheila talked about it. And I'm only catching up with it many years later and realizing, okay, this particular one does this to me, and I need to pay attention to that. I think I tried one that gave me hives and I didn't quite notice, but because someone else had really advocated for it, and we get really hungry for solutions. Like the one thing that's very clear is there's no medication for endo. It's still
Trials.
So yes, you find supplements that have endo something on them. This is gonna fix. Yeah, talking from someone who has a whole cabinet it's not a fix. So also manage your own expectations and realize that this medication is try and error. The world is still figuring it out. So help yourself by learning, like, what are my triggers when I take this particular one? What happens to me? And you know, kind of keep track of yourself, not only with the medical things but with your body. You know, for the longest time I really thought there was something wrong with my shoulder, like maybe I need surgery because there must be something I inherited. Until you realize, no, this is a thing, an endo symptom. I think it's those little things that
And you know, speaking of which, I as a lover of eggs, I recently realized I needed to reduce on the amount of eggs I was eating because I would get really bad flares. And we were in the kitchen trying to prepare some tea and we were laughing about certain teas. I agree with Jean. Please listen to what your body is responding like, because endometriosis is an inflammatory disease. 1 minute you enjoy beans, the next minute you eat beans and you feel like you're going to die. So while I understand that sometimes what fasting is get off all this, please don't shock your body. First, try to wean yourself in bits, because some of us, when we get diagnosed with endo, get rid of all that gluten, get rid of all that milk, and then your body is there stuck with no support system. Because even with the supplements you're taking in, your kidney has to do all this work of so please just go a step each day. There is someone I know had to get off avocado. That does not mean you should. Like she said, it's very individualized because endo affects us differently. And I think the other fact is that staging does not equate to pain. So, you know, just because someone is in stage 4 or is even unstaged does not mean that someone in stage 1 is not going to have as much pain. You might find that someone in stage 2 is dying, but Mulunji of plus, you know, she has her days. So please be very gentle on your already ailing body.
Yep.
And ailing doesn't mean just pain again. It's the little things. Last night, I suddenly just was seeing dots. And now if you had told me that 5 years ago, I would, you know, kind of like rubbish, like if I'm not like crouched up, like whatever. But because it has taken me only bad moments to realize that's a sign of something. And, you know, just seeing dots is not, but, you know, like pay attention to those things that it's not pain shaking, but there's something happening, and see how that affects you, because that means a really massive migraine is coming. So now prepare for it. So now you don't have to wait for just the pain and those little moments.
And the other fact is not every gynecologist is an endo specialist.
Could you say that again?
Not
I don't know
every
how to that thing, but
not every gynecologist is an endo specialist. And because we understand obstetrics, children, childbirth, gynecology, our bodies, right? Our reproductive system. And even further, not everyone who can perform keyhole surgery, also known as laparoscopy, that doesn't make you an endo specialist. Now, doctors, please be more honest with yourselves and with the people you work on. I'm serious. I'm not trying to be disrespectful here. I didn't go to medical school. I'm just a reader. So I know better. And I take it as a responsibility to also share. Because you people tell us, but why are you fundraising? Go to Nairobi. Can't you go to Mulago here? What? Hey, I know why I'm going to Nairobi. Because there's actually an endo specialist that I've identified there. And I've even had a good guy here in Uganda tell me, Sheila, people in Uganda don't know what they are doing. Fellow guy. So I actually believe him. Why? Because I see how people have gone, had it rough. So one of the things, to add it up, so no disrespect, dear guys, if you want to be an endo specialist, we need you. Please do it, actually. And being a specialist is more than 1, 2, 3 trainings, and I'm not trying to be disrespectful, but I know it to come across as it will, and that's okay. All I'm saying is, the other thing you're doing right now, doctors, gynes, is over-diagnosing everything as endo. Fibroids is not endo. This is not just our medical people, also our mothers, our fathers, who tell us, hey, but this tea, the what? Even though I had bizimba in the stomach. Now what's what? Guys, difference. Anatomy, pictures, all of us have phones. Google is our friend. If you're truly interested in me, interested in what I'm suffering from, and you care enough, just do a bit of reading, just a bit. Google fibroids, images show up. It's really different. It's really, and for me it gets frustrating, by the way. I get tired of having these conversations. My friends know, I'll send them links. Did you watch our thing? We talked about it. Did you? Because it gets tiring. Repeat it. If you get angry, come across as angry, bitter, and maybe I'm angry. Why am I not angry? Why shouldn't I be angry? It's a very painful disease, people. It's not fun. You see us laughing, but it's actually not funny. People have been cut up unnecessarily. Not just in Uganda, by the way, the world over. Cut up unnecessarily because we also know you profit off surgeries. So maybe government, please pay our doctors better. But better still, please, if you don't know, refer someone to someone else. That's kinder. You people say, I think in the medical oath, it's supposed to not harm, do no harm. Do no more harm. Yes, Hippocratic oath. Thank you. And it will be so, man. Now we have to know. Please do no harm. Thank you very much.
To actually add on to that, endometriosis does not mean that there is absence of other illnesses. I have endometriosis, I have adenomyosis and fibroids, and God knows what else. There's someone I know who has adenomyosis, endometriosis, lupus, and PCOS. So this can actually, sometimes within the endo circles, we laugh and call them a cocktail. So you find that endo may, because most times they stop at, it's estrogen dominance, but you find someone with PCOS who also has it, and for them they tell them, that's testosterone dominance. So sometimes when we are dealing with these conditions, it's not just endometriosis, it's cool and the gang, but in a setting of diseases. So I wish, I really wish the world would stop and listen to women sometimes, most times actually, because you can't be there, you've gone for fibroids diagnosis, and before you know it, they tell you have a bulky uterus before you know it. So that goes to show you that a hysterectomy alone is not going to save someone who has, endometriosis. Why? Because you're not dealing with the cause. So please be on the lookout for that more than one condition can exist within a very tiny body. Did I hit a nerve?
Yeah, so many nerves. And one of those is also the scars that then leave you with new problems. So they're not in any of those. I think with my last scan, which was very interesting, which was part of my boiling anger, was then to tell me, all right, you have, sacks of liquids, but we can't do about it because it was from, like a bad surgery. Like talking about the dishonest in this space and everyone trying to be an expert. We would really appreciate saying, I don't know, because fast forward, now for life, I have to medicate this thing that is not any of these diagnosed things just because of scarring from an endo treatment gone wrong. And those become very difficult to deal with. There's a running joke about why is endo not considered a cancer. I was hoping that she kind of talks about it because I think she articulates it so well. Endo is not written on our faces, but that means that a day that you find Mulunji glowing, let's not make assumptions that you must be great because it's not all pain-filled. It could be just your head is not in a good space, or anyway, you hit so many nerves, I'm still trying to process where all those nerves.
Actually, about scarring. So because that's linked to inflammation as well. So the more surgeries you have, it's not good for us. We're not looking to have surgeries. It's not fun, guys, being cut up. We're not trying this. It's not fun being cut up because every time you're under that anesthesia on that table, you could die. That is why. So while there are two things that are being said right now that we are looking at as facts. One, for the longest time, they're saying the most sure way to diagnose endo is through laparoscopy, which is simply put a camera inside the body and look. And typically, where do they put the camera? Through the umbilicus. So you're looking for what? Endo in the pelvis only, right? So if it were like in my thoracic cavity, in my chest, you're not going to see it, right? But again, that's the one for sure because the camera looks inside. Then the other one that thankfully is also being used where they don't need to cut you up, make small incisions, whatever, to put a camera through, is the transvaginal or transrectal scan. That is a fantastic way because it's less invasive than cutting you up. However, that only applies to if your endo is like stage 3. It's in that point of your body, in your pelvis. Because then they will have a good view of your liver, of your kidney, of your bladder, But what happens if it's up this way? So there's so much work that needs to be done. But doctors, please, don't tell us we have endo by just an ultrasound. No, you don't see those lesions. You don't. But those who do, few are trained to look for those who can tell that this is a fibroid, this is actually an endometrioma. Because remember, my first place I went to, I was told I had cervical cancer because I had a bulky uterus, which was adenomyosis. Then I had my ovaries were very swollen. Even me, I knew I didn't have that thing.
To be honest, we could talk till the cows come home because this is a disease that is currently still being studied. And about 2 days ago, I was reading about some new endometriosis guidelines that were released within the US where they are trying to look at change in diagnosis and all, and a few recommendations here and there. As we continue to do the work, learning to live with this condition, we really need you to know that endometriosis is one of the top 10 most painful diseases in the world. There are women who have endometriosis that have given birth that say they would rather
give birth
than bear endometriosis pain. So, and it does not just affect us, the older ones. Me, right from my very first period, I knew something was wrong somewhere. So that teenager who is telling you, "Mommy, they are coiling up, they are throwing up, they have to change. They use packets and packets of pads. Their pain is not in their heads. It's not that they don't want to go to school. We need to look into pain because I recently was reading again in America. I really envy them because I feel like almost all the studies are there, and they were finding endometriosis in 8-year-olds because nowadays children are having periods as early as 8. Of course, there is that going conversation around endo being found in men.
True.
Maybe the world would now pay
more
a bit more attention. But yes, we could tell you all the facts, but we can't exhaust all of them. We really encourage you to, when you watch this video, please do share with your family and friends. And we also want to tell you about today's sponsors.
Oh, okay. Thanks. But before that sponsor, can I say something? Sometimes when you read the symptoms of endo, like the common, apart from the pain, they will say like overweight, long periods, heavy periods. Those are not my problems. I was never overweight. I was never. So even like I think the ones doctors use, what they call it, differential diagnosis, it's not what applies. For me, my periods were not that heavy. They were quite light. I've never been overweight. Now I'm beginning to be overweight. Post uterus, I'm beginning to be overweight. So in fact, maybe this is the call for us Africans to do our own research, because what we're working with is very Western, and we know we have different bodies, so there are things you really like, but this is not my experience, but this is not my experience, but and yet it's still endo, So researchers out there, statisticians, whatever, help us, please help us.
We can help ourselves by keeping track of our own bodies. Like if I had started journaling when I was 13, there's a lot of things that would have made sense. All I thought I was a very sickly child, and maybe I'm frail, and I have, bad asthma and all these things. In hindsight, it all makes sense. And kind of teaching you not to take anything for granted. I've always felt like, if I sit funny, my legs are gonna, give way, and I would make fun that I'm going to be that person who, becomes a judge at 30 because, I was really weird with my legs, and that was like a teenager. So if we can not normalize anything that makes you feel like, this is a bit different, then it's okay for you to kind of, see what that is for you.
Yeah, our strength should not be measured by how much pain we put up with. We are not Eve. Eve ate that fruit and died. So no, we are not paying for any. We are not paying for any sins. We will keep raising our voices about this condition, and who knows, maybe we'll get some African perspectives, because there are certain things that we are more predisposed to compared to our white counterparts. So our sponsors before we go.
Yes, our sponsor today is Kagera Safaris. So please find them at www.kagerasafaris.com. It's a tourism company. They operate in Uganda, Kenya, Rwanda and Tanzania.
Yeah.
So please check them out. Thank you very much for sponsoring us, Kagera Safaris.
On your brain fog day, you can use them to have a nice trip out of
Yes, or sponsor us for a trip.
Oh, by the way, yes, we could actually have a conversation about if you want to sponsor us to talk about endometriosis or to just sponsor Thrive.
Because endometriosis, another fact, is a very expensive disease. The Visan, which harms you and helps you a bit, is now how much? 600K, some ridiculous amount of money. So you have seen us fundraise, not because it's fun to put our paper names in the papers and ask for money. No. It's a very expensive disease, so that's a fact. We dream of a fund. This is all we keep talking about how we dream of a fund one day. But please, if you can, as and when God enables, please sponsor an episode by
getting into our DMs, get into our DMs. But also, if you feel generous, you can sponsor someone with endometriosis.
Yes,
it's very, very expensive to live with. But for now, we are going to sip what's remaining of our tea. I'd remind you to like, subscribe, leave a comment in case you feel seen and heard, and we'll catch you in the next episode of Private Malonji. For now,
bye.
Ciao.
Bye.